I think the younger generations of people in general are just being more in touch with, paying attention to their mental health and their well-being, and again, sort of that work-life balance aspect as well. Does the data show things getting better? It sounds like there's pretty high prevalence. Are things improving recently, or what's the actual trend been like?
Well, we did the CMA, a National Physician Health Survey that was done first in 2017, and then the second one, the follow-up, was in 2021. And Jordan, it confirmed what we suspected, especially with the impact of the pandemic, that unfortunately there was a bigger impact on the health and wellness of physicians and learners, because this survey was done across Canada in all provinces, and it included not just practicing physicians, but also the learners. So we were able to get a sense there of how things were different. And what's alarming is that we found almost double the rate of burnout, high burnout, compared to the 2017 survey. So now we were seeing in 2021 rates of about 53% of physicians and learners reporting high burnout rates. But what's even more alarming, digging into some of those other health outcomes, is that almost 50% also screen positive in a depression question. About 25% also reported moderate to high levels of anxiety, and even suicidal ideation went up. So these are all alarming signs telling us that there is huge impact on the healthcare system pressures plus pandemic on the physicians and learners. So this is really important information that we need to continue tracking and continue measuring.
It'll be interesting to see how it plays out. Just anecdotally speaking to like my own patients that I see and their mental health, it seems like there has been an improvement. I would say noticeably over this last year, people are starting to socialize and feel less isolated, and depression and anxiety seem to improve. Do you think that's going to lag in the actual healthcare industry for the workers itself? Do you think it'll kind of keep up, or what's sort of your sense?
Well, it's interesting. I've not seen data yet to support or to give us a sense or a trend of improvement. And honestly, for us, the next survey is going to come out maybe in 2 years so that we can directly compare the measures. It's an interesting question, because when we speak to colleagues, to patients, to stakeholders, um, the distress continues, and I think the suffering continues. The pandemic, the worst phases may be over, but we are now still in a very real healthcare crisis with huge pressures. Family physicians are still really struggling at the moment. Administrative burden is higher than ever. We hear now about moral distress. So I'll be very curious to see if some of that is true, Jordan, in the research and in measurement. What is encouraging, however, is the interest and the concern that everyone is expressing now around physician wellness. I think what we're seeing now is collaboration, it's partnership, it's groups saying we need to do more than talk and acknowledge wellness. We need to actually move to action. And so there's been a big shift actually towards, and maybe that's where we feel a little bit more empowered, emboldened, is that we're finally at a phase where we're saying enough is enough. We need to work together to do something to improve wellness. So I'll be very curious to see, and I do hope that our results improve over time in the next National Physician Health Survey.
Fingers crossed. We'll see what the data shows. So you've had your finger on the pulse of just the wellness side of things, both in the hospital scenario and both in the like faculty of medicine and the teaching departments. How are things evolving over the years, in your time in this field? How have you seen things changing?
Yeah, and that's really been interesting for me to watch now that I'm working in the area for a few years. And many things have changed. When you think about the evolution of physician wellness, actually, in the 1970s or 80s, the focus at that time was really about substance and disabled physicians or capacity of physicians. And so the treatments were completely focused on substance. And then over time, I'd say in the 80s or 90s, we saw the evolution of physician health programs. We saw that in the States and a bit in Canada, with a broadening of of issues that we're focused on. So no longer just the substances, but it was really about, hey, we need to look at mood issues, anxiety, and other health issues. So we saw the expansion of physician health programs. And then what we saw later on is the inclusion of wellness programs in faculties of medicine. So in Ottawa, this began in about the year 98 to 2000. And then I'm pretty sure every university has now some version of a wellness program or robust wellness resources. So that's been a big evolution. And now what we're seeing is organizational wellness, right? Where organizations are now taking steps in their structure, in their leadership, in their policies and procedures to really make a difference in wellness. So that's been part of the evolution that I've seen. Going back to burnout is probably the first theme that was identified early on. Again, that's now expanded to a whole gamut of a variety of health issues that physicians face. And actually, I'll add not just mental health. What about physical health? There's a strain and there's MSK injuries that physicians experience. If you're a surgeon, if you're an obstetrician, just the years of certain movements or certain positions. What about exposure to violence? That is affecting health. What about fatigue relating to physical? So there's a whole gamut of health issues that physicians are facing. So a broader kind of appreciation of all of those elements. The other thing we saw, the expansion from not just treatment or the reactive component, but really proactive prevention, education around wellness, advocacy at the front end. There's programs like WellDoc Alberta, actually, that in the last 5 years have really created a program that's a collaborative where they're working on that proactive angle to educate, to teach about physician wellness literacy, about measures, how to engage leaders in taking on work to improve certain pain points with their staff, with their teams, and then measure and track some of those initiatives to see what difference it makes. So that's been just one example of a group really focusing on the proactive approach. And I'll have to say as well that the physician health programs, beyond just treating when there's illness and clinical disorders, they've also been stretching to include also some prevention and some education. So that's been a shift. So those are the things I would say. And again, the really emergence of the leadership role in wellness. So, you started seeing across organizations some wellness champions, advocates. And that's become more formalized. We now have formal leadership positions in health and wellness. We've got training programs in the States. There's probably the more recognized one is the Chief Wellness Officer course from Stanford, with a very robust training program to become a wellness leader. But there's other opportunities for training in Canada as well. Canadian Medical Association, through their physician learning program, also there's a module on the basics of physician wellness, but there's also a trauma-informed leadership course. There may be other courses more focused now on wellness or safety. So more to come, but I think of two groups that could benefit from that leadership training. There's the wellness champion or leader that would definitely benefit from the core leadership skills. But I also think of any healthcare leader or administrator that would benefit from learning about physician wellness, certain skills, certain, the evidence, the literature. So the return on investment, so to speak, the why. So I think there are two groups that really would benefit from more support, more training. So that's been also the evolution that I've seen. So those are some of the trends that I've seen change over time.
I'm Dr. Jordan Vollrath, and you've been watching Cherry Live, brought to you by Cherry Health. Please like and subscribe to see more clips like this, or check us out at www.cherry.health, Canada's medical network.